This question is for my the small tribe of us anthropologists and other allied social scientists who are working, in healthcare. For us, at least from the background that I come from, looking at people holistically is really a fundamental starting point. Mm-hmm. Going into their lives and seeing people in the context of those lives and seeing them not as isolated individuals, but as members of communities, of cultures, of families, is something that's part and parcel to the anthropological mission. Where do you see a role for anthropologists and engaged social scientists in this mission for more careful and kind care?
Everywhere. Do I need to elaborate?
Can you give us an example? Perhaps I know you've worked and collaborated in the past, or a place that you see perhaps now that is in particular need.
Yeah, so I mentioned the work on shared decision making. From the beginning, we work with healthcare designers that brought up methods of ethnographic research and participatory action research to try to fully meet the needs of the users in what we were doing. We've worked with Carl May, a sociologist in the UK, to understand how people work together to implement innovations in practice, and then extended that work to understand the work of being a patient, which then led to the concept of minimally disruptive medicine, which is this approach to healthcare in which we try to boost the capacity of people and minimize the workload so that they will not be overwhelmed by healthcare, and they will have more capacity to live their lives more fully, not as a professional patient. So there's a ton of examples where the social science discipline put to use builds a better picture of the problem, offers up additional ways of moving forward in terms of theoretical basis for different interventions, and also offers ways of assessing the impact of those interventions beyond the simply quantitative, which tends to be too reductive for what care is about, which is a fundamentally complicated, emotional, interactive, contextually sensitive activity for which much of the reduction that is necessary to fully capture the effect of interventions denaturalizes the process itself. And so the division of social science, medicine, I think it is, some people want medicine to be a data science. They're missing the boat. Medicine, nursing, caring is a fundamental human endeavor, and the sciences that understand and explain human interaction, human relationships, human behavior are, economics, sociology, anthropology, design, psychology. These are all fundamental to this process, and trying to solve and address the issues of healthcare without that input is very disadvantaged.